So always keeping in mind the patient's goals and really the specific objective that you have for your treatment, meaning you have assessed that whole person and you may have different dysfunctions that you do want to address in your treatment. But if you want to have a very efficient approach to a persistent diastasis, you want to work with your exercise parameters to make sure that you do include that some of the loading in your muscle to get that strength training aspects in your treatment, in your exercise program. You also want to play with the parameters such as your weekly frequency. You need to consider if you're doing aerobic or anaerobic exercises in your frequency. So you need to work with these parameters because you may have different objectives from your treatment plan. So make sure that you do consider your whole treatment plan in your exercise program. Make sure that your program doesn't only include the dysfunctions you have that creates problems. You want to also work on the prevention side. So we know that pretty much every woman that have been documented in science and after a year postpartum do have decreased strength, endurance, and power. And on the long run, we also see many women that after a few years after the delivery, they have back problems, they have all of these other issues. So even though you may want to work a very specific, you have a very specific target that's the objective of your client, try to include these aspects on a prevention maybe objective to make sure that you have that when you leave this woman after your treatment, she will have improved on all of these muscular aspects that are needed to function in everyday life, especially with young kids. Also consider that the abdominal wall, yes, you want to do strength training to have all of these changes in the muscle tissue, but you need to remember that the muscle from the abdominal wall do have a majority of type 1 fibers, meaning that you do need to have some endurance aspects in your treatment exercise program.